So today with our patient, we're going to be using transcutaneous electrical nerve stimulation, or TENS, and the indication of when you would want to use TENS is if the patient is experiencing chronic or acute pain. This type of electrical stimulation will help to alleviate that pain. And a precaution that you want to be aware of is if the patient has abnormal skin sensation in the area where you want to use it. And then a contraindication is if the patient has a pacemaker, you do not want to use any electrical stimulation with that patient, or if they have impaired circulation, because they might have like a deep vein thrombosis, and the E-Stim can sometimes let that thrombosis turn into an embolus. So you want to be very careful with that. So just making sure that you are being safe with your patient is important. How's it going, Jimmy?
Good.
I'm Justin, or I guess we've been doing therapy today together. So we just finished our therapy session, and you mentioned how you've been having some pain on your left knee. Is that correct?
Yep.
Okay. So what I feel like we can do next is doing some electrical stimulation for your knee. Have you ever heard of that before?
No, what's that all about?
Okay, well, I'll tell you. So electrical stimulation, we're basically going to use this machine here, and we're going to place some electrode pads around your knee, and the machine's going to cause an electric current to run through those pads, and it's basically it's not going to hurt at all, but it's just going to help with the pain. It's going to help to alleviate the pain that you're feeling. Okay, how's that sound?
Sounds all right to me.
Okay, great. And to do that, I'm just going to need to place the electrodes on your knee, and probably, have my hands there too. Is that okay if I do that?
Yep.
Okay. So to start out, I'm just going to put this under your leg, just so it's a little bit more comfortable for you. Then I'm just going to take a look at your knee real quick. And then, do you have any pain on the back of your knee at all?
No.
No? Okay, great. Just making sure. And then talking to with your primary care provider, has he ever mentioned any like circulation issues or problems with circulation you've been having?
No.
Okay, great. Just to make sure, we don't want to be using this if you've had any of those problems before in the past. Okay, so for our patient today, we're going to be doing high rate TENS. So that is a biphasic pulsed current. So we're going to hit the biphasic button. And then the time that we want on here is going to be, it says 30 minutes to 60 minutes, depending on, the level of pain they have or how much pain they're having. So we'll do 25 minutes for this treatment. And then we're going to set the rate, and we're going to set it up to 90. And this is the pulse frequency, so this is how many pulses per second. And then we're going to go to our width, which is the pulse duration, and then we're going to lower that down to 100 because we just want to be stimulating those those A-beta fibers. And so this is going to use the gate control theory for pain. Stimulating those A-beta fibers is basically going to stop the nociceptive signals going up to the brain, which is going to help control the pain. Okay, for this electrical stimulation, I'm just going to place these electrode pads around your knee. Okay. And then I'm going to just turn up the intensity, and I want you to let me know when you start to feel a strong but comfortable tingle. Okay? So just let me know when you start to feel it. Feel anything?
We might be getting there. Got something.
Feeling some tingles?
Mm-hmm.
Okay. Just let me know when it's like a strong but comfortable tingle.
That's probably good.
That's good? Okay. Awesome. I'm just going to start the timer. Okay. And then are you feeling any pain with that at all?
No, pretty good.
Okay, great. We're just going to say that the treatment time has passed. Okay. How's that feeling for you, Jimmy?
Doing all right.
Doing good? Okay. I'm gonna go ahead and stop that now. And then I'm gonna go ahead and remove the electrodes and just take a look at your knee. Sorry, sometimes those can stick. Okay. Are you feeling any pain in your knee at all?
Nope.
Okay. And then it looks good. Don't see any like redness or anything out of the ordinary with your tissues. So, sounds good. I guess we'll see you next week then.
Perfect. Thanks, Justin.
No problem.